Hi, I'm Dr. Evan Mountford, and today I'm going to share some information with you that I've learned about the most common causes of lower back pain that I'm seeing in my office. I'm a chiropractor and I've been since 2008, and the most common reason that I see people coming into my office is simple lower back pain. The problem that I see is that most people think it's not that big of a deal. They're just going to most of the time wait through it just to let it go away. The most common cause of lower back pain that I find is a problem with the SI joint. This is your spine. These are the parts of the back right here where you see those little bumps in the back of your spine. These are your pelvis. This is your pelvis right here. These are your hips. Okay. The most common area to be injured in the back are these things here called the sacroiliac joints. We also call them SI joints. This is the second most important joint in your body, second only to your jaw. Each joint in your body has something called proprioceptors. And a proprioceptor is a special kind of nerve that tells the brain what's going on with that joint. And the most important joints in the body that scientists assume are the most important joints are the ones that have the most proprioceptors. This sacroiliac joint has the second highest number of those proprioceptors. So if trouble happens with either this joint, with your jaw, with other high priority joints, the body will sacrifice other areas of less importance in order to be able to compensate. The jaw is essential for eating. The SI joint is essential for walking, which is another huge survival issue. So as you walk, it causes this rocking motion that allows the sacrum, which is this bone right here, this triangular bone, which is the base of your spine, to go through a figure-8 motion. That figure-8 motion is part of the mechanisms that allow the cerebral spinal fluid to circulate throughout your spine. The cerebral spinal fluid is the thing that delivers all the nutrition to your nervous system. So there's a huge connection with simple lower back pain, which interrupts this normal flow of the nutrition to your nervous system and your health. As that flow of your nervous system is interrupted, you can imagine that there might be other effects, right? So as a common problem with the lower back pain, when this joint here comes out of its normal position, for instance, in some sort of an impact, it could be a car accident, it could be a sports injury, it could be chronically sitting with your right leg crossed over your left, or vice versa. Whatever it might be, it's very common for people to injure this joint. When the joint injures, it slips out of its normal position. And instead of having things lined up, they become tweaked. And as a doctor, it's very easy for me to determine. And you can do this at home on your own. If you have a friend or yourself that has lower back pain, what you can do is have you lay on a bed with your feet hanging off at the end of the bed and your head straight ahead, and have someone look at your feet and notice if there's one foot that's shorter than another. That's one of the telltale signs of an issue with your lower back. And the reason is because when this shift happens in the pelvis, the axis of rotation for that shift is behind the insertion of the hip. And so as we turn it, the hip comes up just slightly, and that makes that leg look shorter. There's lots of issues that come into play with this, and I could go on for this for a long time and bore you to death. The short of it is that this condition spurs on a whole multitude of other conditions, including sciatica and disc herniations. And so taking care of this early is in your best interest, because the longer that it's present, the more serious that it becomes. So to sum up, the issues here in the joints in your sacroiliac joint that cause that simple lower back pain, the most common cause of lower back pain can be something that can actually cause many other issues. So when the pelvis gets out of alignment like this, it causes asymmetrical muscle spasming. Muscle spasm on one side to protect that joint so you can continue to walk. Also causes issues where there's a decreased motion in the lower back, so you feel stiff in the morning, or you feel stiff when you get up after sitting down for a long period of time. Those things are indications and signs of a more serious condition that's happening. It can be the cause of issues in the knee or issues in the feet. It can be the cause of issues even up in the upper shoulder, in the neck. And the reason is because once that leg length changes, it changes everything. The gist of it is that don't wait for the symptoms to get worse to take care of it. It's like when the check engine light comes on in your car. You want to take care of it right away, not wait till the car blows up. Or when you hear a fire alarm, you want to make sure you check it out, make sure there's no fire, or if it's just something to take care of it quickly before it becomes a real issue.